Severe frostbite can lead to devastating consequences, often resulting in the surgical removal of digits. For medical professionals, finding effective treatments to preserve limbs and improve patient outcomes is paramount. Today we delve into Aurlumyn, a newly FDA-approved medication offering a beacon of hope in this critical area. Aurlumyn, pronounced Aurlumyn, is the brand name for Iloprost injection. This medication is a prostacyclin mimetic, administered via intravenous infusion. Its primary indication is to treat adults suffering from severe frostbite. The goal of Aurlumyn therapy is to significantly reduce the risk of digit amputations. It represents a crucial advancement in managing this challenging condition. Aurlumyn works by binding with high affinity to both human prostacyclin, prostanoid IP, and prostaglandin EP1 receptors. This action classifies it as a potent vasodilator. By relaxing the smooth muscles and artery walls, Aurlumyn effectively improves blood flow to affected areas. Furthermore, it helps relieve high blood pressure and inhibits platelet aggregation, preventing clot formation. Iloprost is a synthetic analog of prostacyclin PGI2, mimicking its beneficial effects on the vascular system. The effectiveness of Aurlumyn was rigorously evaluated in an open-label, randomized controlled trial. This study involved 47 patients with a mean age of 33 years, and notably, 94% were men. Frostbite involvement varied, with 70% experiencing frostbite in their feet, 62% in their hands, and 32% in both. Patients receiving Iloprost intravenously for 6 hours daily for up to 8 days showed significantly lower bone scintigraphy anomaly. This anomaly is a critical marker predicting amputation risk. The results were superior compared to those treated with buflumetal. Aurlumyn received FDA approval on February 14, 2024, marking a significant milestone. Aurlumyn is administered as a continuous intravenous infusion. The initial recommended starting rate is 0.5 nanograms per kilogram per minute. This rate should be carefully titrated in 0.5 nanogram per kilogram per minute increments. Titration should occur at 30-minute intervals based on patient tolerability, up to a maximum rate of 2 nanograms per kilogram per minute. The infusion is typically given for 6 hours each day for a maximum of 8 consecutive days. For patients with moderate or severe hepatic impairment, classified as Child-Pugh Class B or C, the initial infusion rate must be reduced. Start at 0.25 nanograms per kilogram per minute and then titrate as described previously. Similarly, in patients with renal impairment, eGFR less than 30 milliliters per minute, who cannot tolerate the standard starting dose of 0.5 nanograms per kilogram per minute, the dose should be reduced to 0.25 nanogram per kilogram per minute. Careful monitoring is essential for these patient groups. Aurlumyn may cause hypotension or low blood pressure, which can manifest as dizziness, blurred vision, or confusion, especially upon standing. It is crucial for healthcare providers to correct any pre-existing hypotension before administration. Vital signs must be closely monitored during Aurlumyn infusion. Consider temporarily discontinuing any antihypertensive medications to mitigate the risk of severe hypotension. If hypotension persists despite discontinuing other antihypertensives and adequate fluid resuscitation, consider down titration or discontinuation of Aurlumyn. Patient safety is paramount, and prompt intervention is necessary. Patients should be advised to avoid sudden changes in position, such as standing or sitting up quickly from a lying position. This precaution helps prevent dizziness and potential falls due to orthostatic hypotension. Before initiating Aurlumyn, it is vital to inform your doctor about certain conditions. These include pre-existing low blood pressure, liver disease, or renal disease. These conditions may necessitate dosage adjustments or closer monitoring. Regarding pregnancy and breastfeeding, no studies have been conducted on these populations. Therefore, Aurlumyn should be used during pregnancy only if the potential benefit justifies the potential risk to the fetus. Breastfeeding is not recommended during treatment. As with any medication, Aurlumyn can cause side effects. The most commonly reported adverse reactions include headache, flushing, and heart palpitations. Patients may also experience a fast heart rate known as tachycardia. Other common side effects include nausea, vomiting, dizziness, and low blood pressure, hypotension. Patients should be educated on these potential effects and encouraged to report any concerning symptoms. Aurlumyn vials should be stored unopened at controlled room temperature between 20 degrees Celsius to 25 degrees Celsius, 68 degrees Fahrenheit to 77 degrees Fahrenheit. It is essential to keep the unopened vial in its carton to protect it from direct sunlight. Do not freeze the product. The active ingredient is Iloprost at a concentration of 100 milligrams per ml. Inactive ingredients include ethanol, sodium chloride, and trimethamine. Hydrochloric acid and sodium hydroxide are used to adjust the pH to 8.3. The solution contains no preservatives and is available as a single-dose glass vial per carton.